The average amount of time it takes to trough a lower molar is approximately 30 seconds. Be sure to use high-speed vacuum in order to remove the steam vapor given off by the laser tissue interaction. As long as the fiber tip is kept in motion, there will be no damage to the collateral tissues. It should be noted that the laser fiber creates less damage to the periodontal ligament fibers than does the packing of retraction cord. And if you are a CEREC user, the diode laser will greatly benefit you. Single tooth crown preparation is probably one of the most frequently performed procedures by general dentists. We use the laser in this application as opposed to retraction cord. Adequate exposure of the margins is critical to accurate impressions. The laser coagulates the bleeding and removes unwanted granulation tissue. We find that troughing with the laser is much faster than using retraction cord, and the hemostatic properties are a significant bonus. Margin exposure has never been easier, and this leads to clear, concise impressions every time. This is a 16-year-old male patient with extensive caries and recurrent decay on teeth numbers 7 through 10. Before placing the restorations, we're going to go around the teeth and coagulate the heavy bleeding interproximally. To do this procedure, we're going to initiate the tip. We're going to use 1.4 watts of continuous wave energy. This is necessary to create a dry field in order to place the restoration. The central incisors will be restored with composite. The lateral incisors will be restored with full coverage restorations. The laterals are in lingual version, so we will be performing crown lengthening at the same time. This will be done in order to create a more harmonious smile line also. The tip is kept moving in a brush stroke fashion. Approximately 2 millimeters will be removed from the facial aspect of the tooth. You'll notice that the only bleeding is from interproximal anesthesia. This also allows us an excellent opportunity to perform laser periodontal therapy around the facial aspects of 7 and 10, which are in lingual version. Be sure and take your time. There's no rush. Always be sure there is a clear visual field. And because there is no collateral damage using the laser, as with the electrosurge, you are able to go back and forth over the same surgical area without fear of damaging the underlying tissues. To maintain optimal cutting efficiency of the fiber tip, you must periodically wipe off or flake off the residue that builds up. Unwanted gingival thickness is removed by gently beveling the surface with the side of the laser fiber. Before reducing the vertical height, be sure to sound the tissue with a periodontal probe so you do not infringe upon the biological width. Always keep the tip moving and periodically stop to remove the residue that's accumulated on the fiber tip. After completing tooth preparation, you are now ready to start with the tissue troughing. At the same time, the laser will coagulate any bleeding that occurs around the tooth. Here the tip is placed parallel to the long axis of the tooth and moved gently in a brush-like motion. Occasionally you will see the fiber tip glow. This is an indication you need to pause for a moment and clean the tip off. To do so periodically optimizes the cutting efficiency of the fiber. After you've completed troughing, you are now ready to take impressions of the prepared tooth. The operculectomy technique allows for easy removal of redundant soft tissue distal to posterior molars. The chronic reoccurrence of pericoronitis, significant periodontal probing depths, or pseudopockets can easily be managed with this procedure. Remove the bulk of the tissue with the laser set on 1.4 watts in a continuous mode of operation with an initiated fiber. Doing so establishes hemostasis, and you are then able to create ideal tissue architecture. Postoperative pain medication is rarely indicated for this procedure. The entire procedure takes less than 30 seconds and is done with local infiltration of the distal retromolar pad. This is the completed procedure, and this is the healed area 2 weeks post-op. Tooth number 18 is indicated for full coverage crown. But first we must understand how we're going to manage the tissue in the retromolar area. A setting of 1.4 watts, set in continuous mode, is used to remove the tissue from the distal aspect. Tissue management here is critical to obtaining a clear impression. It's always important to keep the fiber in motion so as not to create collateral damage to the surrounding tissues. And here is the result 2 weeks later. This is how we manage the tissue around a class 5 carious lesion. There is often a very thin zone of attached tissue, and therefore we use lower power settings. In this case, 1 watt was used in continuous wave mode with an initiated tip. The tip is moved rapidly as to minimize the damage to the surrounding tissues. Controlling bleeding and circular fluids is key to a properly placed composite restoration. Applying the laser to this procedure can save time, reduce frustration and stress. This is immediately post-op, and here is 1 week follow-up. Today we're going to demonstrate how we use the soft laze diode laser to manage the tissue of a smile design case. We're going to prepare 10 teeth, tooth numbers 4 through number 13. All 10 teeth will undergo crown lengthening procedures. Fortunately, periodontal disease is not a factor in this case. Prior to crown lengthening, periodontal probing was done on all teeth. We find it easier to perform the crown lengthening procedure prior to any tooth preparation to get the optimal harmony of the smile design. We will start on the right side, tooth numbers 4 through 8, and then we will go over to the left side and prepare tooth numbers 9 through 13. Feathering of the facial margins is also accomplished in order to eliminate the ledge effect of the tissue. Always take plenty of time, no need to rush it. The tissue just melts away with very little effort at a power setting of 1.2 watts with an initiated tip. Always maintain a light feather touch brush-like motion when using the fiber, and be sure to operate in a dry field. This is always more efficient than cutting in a wet field. After crown lengthening, you then go on and finish your crown preparations. And you are now able to access the interproximal spaces with your fiber. The laser gives you the confidence of knowing that you're not going to encounter bleeding when taking the impression. When you're dealing with 10 teeth at one time, this is the last thing you want. At first glance, it appears as though we've created quite a bit of tissue trauma. However, the patient in this case will feel very little, if any, postoperative discomfort. Healing is rapid and predictable, and there's no gingival recession. This will be evident later on when we see the final post-op of the completed restorations. We see here the opportunity to go in and clean up some of the tissue around where there was old PFM restorations. We will be placing full coverage lava crowns on this case. The total amount of time we spent in crown lengthening with these 10 teeth was approximately 10 minutes. And troughing takes approximately another 30 seconds per tooth. So all in all, we probably have about 20 minutes worth of total time dedicated to soft tissue interaction with the laser. We are now ready to go in with the brush and scrub the tissue right around the margins so it doesn't interfere with the impressions. Now here is the patient, 48-hour post-op with the provisional restorations in place. This is 2 weeks later at the cement appointment prior to removing the provisional restorations. This is what it looked like immediately after removing the provisionals. And this is 1 week post-op. Chronic inflammation from any source is associated with increased cardiovascular risk, and periodontitis is a possible trigger of chronic inflammation. So everything we do to control periodontal disease is going to be of great benefit for the patient. One of the main advantages of laser-assisted periodontal therapy allows a non-surgical approach to treating periodontal disease, gaining easier access to deeper calculus deposits after ablation of diseased epithelium and hemorrhage control. The fiber is initiated and the laser is set in a continuous mode with a power setting of 0.4 to 0.6 watts. Each tooth requires a treatment time of somewhere between 10 and 30 seconds. Molars, especially those with furcation involvements, will take a bit longer. Use a light paintbrush stroke while moving the fiber from the base of the pocket to the coronal portion. Be sure that you are aiming the laser fiber toward the lining of the epithelium and not the root surface of the tooth, as this technique will remove some of the diseased epithelium. When removing the diseased epithelium from the lining of the pocket, it's not uncommon to see a bubbling effect of the tissue. You must frequently remove the residue buildup from the fiber tip. One of the fastest and most efficient ways to do this is to rub the tip gently against the high-speed evacuator edge. Although the diode laser provides great hemostasis, it's still not uncommon to see some bleeding while performing laser-assisted periodontal therapy in the deeper pockets.